Hi everyone, I'm Don Grimes, Executive Director of CaregiverGeneration.com. We've already had one example where the difference in one word can make a huge difference to the impact on you as a member of the caregiver generation, somebody between 35 and 65 who's helping an older relative. Now, we're going to go into depth today on the difference between Medicare and Medicaid. Oh man, they sound alike, but they're actually very, very different. And if you understand the difference, it'll reduce a lot of your frustration. Medicare is our health insurance from the federal government, typically when we're 65 and older. And we've learned from an earlier video, health insurance pays for skilled care, right? Care that's trying to cure us from somebody who has a medical license. And we know that skilled care typically doesn't cover long-term care, help with the activities of daily living, or supervision we may need because we have a cognitive impairment. So Medicare covers hospital stays, part of it, covers some of your doctor's visits, doesn't cover long-term care. The second thing is Medicaid. Sounds like Medicare, but it's very different. And just so you know, different states can call Medicaid different things. Here in California, we call it Medi-Cal. In Tennessee, it's TennCare, but it's all the same program. Technically, Medicaid is a joint federal and state program providing health insurance to the indigent. Health insurance, that skilled care thing, it's not designed to cover long-term care. Now, the irony is that Medicaid is actually the biggest payer in the whole US for long-term care, almost half. And the way people get to that point is they've gone broke paying for their own long-term care. So Medicaid is also a health insurance program. The difference is it's a joint federal and state program, so different states can have little variations of it. But the key thing that's typically true in all 50 states, you have to be indigent to go on Medicaid. You got to be broke, which is a bad spot to be no matter how old you are. And since it's a health insurance program, it's not going to routinely cover care in your own home or assisted living. It typically will only cover care in a nursing home. So even though you may actually not be so darn sick you need to be in a skilled nursing facility, that's typically what Medicaid will pay for. So the key thing is have the information you need as a member of the caregiver generation so that you can help someone who's older when they need the care, but more importantly, you can plan ahead yourself. For more information, go to caregivergeneration.com. I'm Don Grimes. Thanks for tuning in.